of the circle has something that keeps it strong called a beta-lactam. Most antibiotics work by going in, breaking this beta-lactam, and then making the bacteria bleed out. If you have a cold, most colds are caused by viruses. They don't have any kind of cell wall structure like this. So a beta-lactamase won't do anything. The only thing that will happen is that it will kill the gut bacteria, the gut microbiome that I was just talking about that might be good for you. And that's why a lot of people will suffer with things like diarrhea when they're taking antibiotics. The other thing that a lot of people do is they'll take it for a few days and then they'll stop. They'll say, "Khalas, I feel good. Why do I need to continue taking this?" The problem with this is that bacteria are very much like cockroaches. I grew up in Brooklyn. In Brooklyn, we have a massive problem with cockroaches everywhere. We'd call the exterminator would come, he'd kill the bugs, we thought we were good, the house was clean, everything was good. 2 weeks later, cockroaches come back with a vengeance. They come back angry, they take over the whole house. And this is a problem that is very much like your body. What happens is the bacteria can mutate. They could become resistant to the antibiotics that you are taking because they mutated. And now you're talking about using a completely different class of antibiotics in order to get through this infection. So please finish your course of antibiotics. The second to last one is that breakfast is the most important meal of the day. This goes to everyone who's generally healthy. You young guys in the middle. I'm talking about you guys. For anybody who's suffering with diabetes or things that affect their metabolism, I'm not referring to you. Please tune me out for the next 2 to 3 minutes. Intermittent fasting is wonderful for you. The Prophet ﷺ used to intermittently fast Mondays, Thursdays, the 13th, the 14th, and the 15th of every month without fail. And this excludes Ramadan. The benefits, research is just catching up to how good this is for you. They're talking about weight loss. They're talking about reducing inflammatory markers. And inflammatory markers is a fancy way of saying things that could cause things like Alzheimer's, arthritis, asthma, multiple sclerosis, and stroke. The benefit is astounding, and it's not as difficult as you might think. A lot of times we go to sleep 8 hours, or at least we should go to sleep 8 hours. That's your 8-hour fast. If you go to sleep and you stop eating 3 hours prior to your bedtime, you're at 11 hours. The goal with intermittent fasting is between 12 and 16 hours. If you hit that, you will start feeling the results of it. Now, during the first month, everyone complains. I feel sick, I'm fatigued, I'm nauseous, and the wives will say, I'm irritable. And this is a very, very common thing. The wives complaining of the husbands, that is. These all pass. After a month or so, you start to feel the benefit of the intermittent fasting. The last thing I'm going to say before I let you guys go is regarding Big Pharma. In the news, you see a lot of people saying Big Pharma is the devil, Big Pharma is trying to kill us, and all of these things. This past COVID situation aside, when you look at Big Pharma, yes, their medications are overpriced, but you have to understand the economics of it. To get a medication approved, it takes anywhere between 8 and 13 years. So the medications that are coming out now are at least 8 years old in terms of the technological advancements. The price on getting a medication approved is anywhere from $350 million to $5.5 billion per drug, depending on the complexity of the drug and the application itself, the complexity of the application. This doesn't mean to say that the prices are always correct. This is just to say that this theme that Big Pharma is against us isn't true. In general, most people take very simple generic medications. And in general, these medications are ridiculously cheap. In fact, we usually give it away for free just because of how cheap it is. And if people can't afford it, you're not going to hold back medicine. At the end of the day, they need to continue growing, and the medicines they create become better. And eventually, inshallah, they become a generic, and then it becomes cheaper for everyone. But that's pretty much all I have. I tried to make it as quick as possible for you guys. I'm sorry if I took too long. If you guys have any questions, I think I've got a few minutes that I could take questions. If you don't want to blow up your spot and say the questions out loud, any of these guys with green shirts, you guys could attack with questions and they should answer it. And if you guys have anything, yes?
So you talked about the biome, the bugs inside. What about probiotics? People take external probiotics. How good are they? What amount they should take? They have
All of these things, I'm going to tell you guys, are not the best to buy over the counter. There are prescription grade versions of literally every vitamin you buy.
Can you repeat the question? They didn't hear it.
Of course. So the question was, what do you make of the probiotics that everyone says you should take? The ones that say 25 million, the one that says 2.5 billion, and all of these things. So a very, very big disclaimer is that you don't know what's actually in any of these probiotics. The type of bacteria matters. If I put something like streptococcus in a probiotic, I'm going to cause you to get an infection. If I put a certain strain of something called staphylococcus, then it might have benefit. Then there's a certain strain of staphylococcus that has zero benefit, and it could cause an infection. All of these are things that you have to pay attention to. You don't know what's in it, and if you look at each of the labels of anything you buy over the counter that's a vitamin or a supplement, they will tell you the FDA has not confirmed that these statements are true or that this supplement is actually effective for the things it says it does. Now, do I think probiotics are good for you? Absolutely, they are good for you, but they have to come from a reputable source. The idea with probiotics is that think of it like there's a war in your stomach with a bunch of different colonies. Each of these colonies is a different bug. When you take an antibiotic, one of these colonies is suddenly killed. So now the other ones have taken advantage and they've grown. You've created an imbalance. This imbalance in your microbiome can sometimes be unhealthy. Conversely, you might be someone like me. I eat a lot of trash. I eat a lot of trash from the street. Not from the street literally, but from like restaurants that are relatively dirty, places that you probably shouldn't eat because I'm always on the go, I'm running around, I need a burger, I'll grab it from this place, I'll need a chicken sandwich, I'll grab it from this place. I have a bunch of gut microbiome that feed off of that. So I have a bunch of unhealthy gut microbiome. If you feed your body with healthy things, the healthy gut or the healthy bacteria will grow because you're feeding them more. You're kind of switching sides and you're giving more ammunition to a different type of bacteria. And research is showing that these days, these different bacteria actually have an effect on your hormone levels. And they cause you to have cravings for the things that that bacteria likes. So for example, if I eat a lot of greens, I will have an increased amount of the gut microbiome that digests those greens. And this will, in fact, cause me to crave these greens more often than I would for things like cookies and cake. Good?
Yes, thank you. Another question from sisters. How often can you do the intermittent fasting? Can it be daily? Is it only okay on certain days? If you can repeat the question.
So the question is, how often can you do intermittent fasting? Can you do it daily or should it be on certain days? So I believe that you should do it as often as you can. The Prophet ﷺ used to do it twice a week. If you want to follow the best of examples, that is the best of examples. Do it at least twice a week, which is a Monday and Thursday, and the 13th, 14th, and 15th of every month. So many things, research has yet to come up to the level of what the Prophet ﷺ used to do. And I think that by following his example, you'll see the health benefits.
Another question? Only one question, sir. So the vitamin industry, it's like a multi-billion-dollar industry. They have GNC and Vitamin World and all those things. How beneficial
So, that's a wonderful question. The question,
The question, how to decide what vitamin we should take?
okay. So it's a two-part question. The first part is what vitamin, the vitamin industry is a multi-billion-dollar industry. How do we know which vitamins are good? If is it worth it? Do you think that there's benefit to it? And the next part is how do we know which vitamins we should take? So, very, very simply, there are a few vitamins that are something called fat soluble. So, four vitamins, K, A, D, and E. These vitamins are very, very common, and the benefit of them is they stay in our bodies a little bit longer. Then there are vitamins that are considered water soluble. Your vitamins K, vitamin C, A, not A. Vitamin C is one example. K2 is another. The minoquinone that I was speaking about earlier. These are very easily replenishable in our bodies. The best way is to go to a doctor, unfortunately. I'll be honest with you, vitamin D is something that most people have deficiencies in because in our current lifestyle, most of us work indoors or spend a good amount of our times indoors. And you'll see doctors almost blanket prescribing vitamin D 50,000 units once a week. It's something that we fill maybe 200 times a day throughout my stores. And it's a very common thing. Now, to know which vitamins are good, again, I would say go with a pharmacy grade vitamin. If you are going with the over-the-counter stuff at GNC, it's very hard to verify that the amounts that they say are in each capsule or tablet or gummy are truly there. And in fact, I want to say about 3 years ago, some consumer affairs department or agency did a trial. They grabbed 3 bottles of the same multivitamin off the same store shelves, and they found differing concentrations of each of the vitamins in each of the same bottles from the same manufacturers. So it's hard to justify it, but if something is a prescription grade vitamin, it becomes a little bit more difficult to alter those because now you're dealing with the FDA, and the FDA will regulate you.
But which are halal? A lot of the vitamins are
So, you asked a good question. Which vitamins are halal and which pharmacy grade vitamins are halal? What I will tell you is go with a vegetarian pharmacy grade vitamin. We stock Al Noor vitamins and we stock Greenstone vitamins. These vitamins, people tend to say, hey, when I take this, I feel good. Does it mean that they have the exact concentrations? It doesn't. There might be alterations in the vitamins. But if you go with a pharmacy grade vegetarian one, then you're playing it safe both ways.
So my question is, mostly if you see all vitamins are like 100 over 100%, are they healthy or not? Because if taking over 100, I mean,
The 100% refers to the recommended daily. So the question was, most vitamins are 100% or more than 100%.
are they healthy or not?
So it's a very good question. Your body could only digest so much of a vitamin at one point. After that, if it's water soluble, you pee it out. Fat soluble vitamins, there's certain ones, and you could actually overdose on vitamins. It's very, very uncommon because water soluble, it'll go through your kidney, you'll pee it out, and you'll generally be fine. However, with fat soluble vitamins, you can overdose. In terms of whether the 100% or the 125% is good, anything beyond what your body could absorb at that moment is a waste. 100% is more than enough. I know that we all look, well, this says 200%, it's even better for me. It's not necessarily the case. There are certain vitamins that we overdose you on. For example, do you guys know what scurvy is? Pirates get it. It's scurvy. Scurvy is an actual disease. When you're too far from land, there's a nutrient depletion that occurs. The way they treat it, the cure for that is overloading you with vitamin C. And yeah, they overload you to the point that you pee out the excess, but that's the cure. So, more than 100%.
also, our daily diet also consists of a lot of vitamins and our diet plus this multivitamins and or
So That's why I say you have to go to a doctor and see what the actual deficiencies are. If you're treating yourself without having any deficiency, then you're either wasting your money or you could be causing harm to yourself. Yes?
There are some medicine which are gelatin coated.
I'm sorry?
There are some medicine that are gelatin coated,
Yes.
and there are some gelatin which are haram or whatever you call it.
Yes.
How does the pharmacist kind of tell us whether this is good or bad for us?
So the question is, there are some medicines that are gelatin coated. How does the pharmacist tell us when this has gelatin and when it doesn't? It depends on your pharmacist. Certain pharmacists will tell you, hey, this is coated. Certain medicines don't. I'll give you an example. Gabapentin is a medication used for a number of things, such as neuropathic pain, mood stabilization, and in some cases, it could be used as a preventative medicine for seizures. Gabapentin 100 and 300 are only coated in gelatin. I've personally searched for a manufacturer that doesn't coat it in gelatin. There are none. And the worst part of it is, some of them will say, hey, this is cow gelatin. Some will say it's pork gelatin. Some will say it's a mix. At that point, our options are very limited. What we do with some of you guys who are current patients with us is we give you the 600 tablet. So a lot of people will take the 300 milligram dose. We take the 600 milligram dose. We split it in half for you because it's a tablet and it has no gelatin, and that's what we'll dispense. Other times we'll warn you. We'll tell you, hey, this has gelatin in it. There aren't many options around this. The last option that we do is, depending on what the medication is, you could dissolve it in liquid. So let's say you need, and I'm going to make the math easy because I'm not very good at it. Let's say you need gabapentin 100. You're not going to split a tablet 6 ways. What you could do is certain things you could dissolve in water, and let's say it's a fixed fixed volume of water. So gabapentin 600, you put it in a 60 ml container of water, you dissolve it. You take your 10 ml and you've gotten 1/6 of the dose. So there are different workarounds, but you have to check if it's something that you could dissolve in that liquid. Certain medications will bind to the water and then they'll become inactive in your body.
Continuation to that, there are some medicines like fish oil, it's coated with the gelatin coating. I mean, there are certain medicines, vitamin D also is the same way.
Right.
Are those gelatins good gelatins or how is it?
So there's no such. It's hard for me to say that. The question was, certain medications only come capped or coated in gelatin. For example, omega fish oil. Are those good gelatins? So, what do you mean by good gelatin? You mean halal? They don't make halal omega 3 prescription grade. So the omega-3, and this is a big quarrel I have, omega-3, the over-the-counter version that you guys get, is not that beneficial for you. The one that you're supposed to get is a combination of the different fatty chains. So it's supposed to be omega-3, 6, and 9. Omega-3 has a very limited benefit, and the concentration of omega-3 fatty acids in it is debatable. With that said, whether they make a vegetarian version of it, as far as I know, no, not yet. But for the vitamin D that you mentioned, they make tablets of it, and that has no gelatin in it.
Any idea why they use gelatin?
Why they use gelatin? Because it's cheap. Manufacturers are trying to produce these drugs as cheaply as they possibly can. The cheapest meat, I don't know if you guys look at pork prices or pig prices. I do, just to compare it to how much I pay for halal beef, and they are so cheap. And there's so much fat on it. So they use this a lot of the times to coat things. And the other thing is, it's generally non-reactive. When you're coating a medication, you want to coat it in something that the medication won't react with it. If it does, they could bind to each other, and then when you digest it, they go down bound to each other, and it never gets absorbed by your body. So gelatin works to keep it from reacting with anything. Yes?
So in some cases, prescribe me some vitamins, say for example vitamin D. So I went to get it from the pharmacy. They said you can get it from the over the counter. In that case, what would be my step?
So the question is, sometimes the doctor will say, here's a prescription for vitamin C and vitamin D, and you take it to the pharmacy, and the pharmacy says, go over the counter, go buy it. So the reason why is, from a pharmacy point of view, there is no money in filling your prescription for vitamin C and vitamin D. Generally, the insurance won't cover it, and it takes time from the pharmacist. So a lot of pharmacies will say, no, 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 just go over there and buy it. Some insurances will cover it. What I would tell you is speak to any of these guys and come to one of our stores, and we'll fill it for you. Don't pay for vitamins, please. Don't pay for anything that a doctor gives you a prescription for. Haram. Any other questions? Yes?
So you mentioned when you get a cold, people usually take antibiotics.
Mm.
It has no effect because it's a virus.
Yes.
So what will prevent it from the virus? What can we take to attack the virus?
So, I'm glad you asked. The question was, you said, or I said, not to take antibiotics when you have a viral cold or a cold, because the antibiotics won't do anything. There are medications that are called antivirals, kind of like how we treat HIV. HIV we treat with a class of medications called antiretrovirals, and they go and they kill the virus. However, they've gotten really good with HIV. They still are lousy at it with colds, partly because there's no money in it, and the second part is viruses are so apt at mutating. As much as bacteria is good at it, viruses are so much better. This is why every year you have to get a flu vaccine. If the virus didn't mutate as quickly, they wouldn't have to come up with a different formulation. And on top of that, each of those formulations have 4 variants, because they know that they, don't know which exact type of that variant's going to come out, and B, they know that it might mutate. So what do you do when you have a cold? Hot soup, rest, Tylenol if you have a fever, and a lot of liquids. Any other questions, guys? Yeah.
So you started a new business,
Yes.
the new different model. Yeah, talk to the, how people can get help from you, how you more personalize the patient here,
So,
how they can get help from you.
my pharmacy is located very close to here. It's called Crossroads Chemists. The way I designed this pharmacy was, very honestly, I wanted to do something that the Muslim community hasn't seen before. I wanted to make a pharmacy that kind of poops on every other pharmacy that's out there. I wanted Muslims to go to a pharmacy and feel pride in their pharmacy and say, that's a Muslim-owned business. And eventually, I see it. You see it in this community more and more. You see places like Khoha. It's a Muslim restaurant. I don't know if I'm supposed to be shouting out other restaurants. I'm sorry to the board if I'm doing this. But you see these other Muslim businesses, and they're showing out. They're showing what we could do as a Muslim community. That's what I did with this pharmacy. So what I wanted to do was make something that we could feel proud of. The other thing is, a lot of our people are going to a place like CVS or Walgreens, where they'll tell you, hey, you need vitamin C? Go outside and go get it. My guys are all Muslim. Every single one of my employees is a Muslim. We like to make sure that we're taking care of our own. So you could speak to any of my guys. You could visit the store. Our bags have our cards and our information in it. Guys, at the end of the day, and I've been told this previously, and it kills me, people will come to me and say, hey, I stopped taking this medication. I couldn't afford it. And for me, I curse. I say, to hell with the price. This is your health. Take the medication. Certain things don't make sense. So you can't put a price tag on health. All you have to do is speak to any of my gentlemen, and they will help figure things out.
So if the medical insurance covers just the CVS, or then what do we do?
So it becomes very, very difficult for me if the medical insurance will say only go to a CVS or a Walgreens. The best bet I could tell you is call the insurance company, and we've had people do this in the past where they call the insurance company and say, listen, I don't want to go to your pharmacy. They treat me poorly. I want to go to my local pharmacy. And more times than not, the pharmacy or the insurance company, by law, they're not supposed to keep you at any pharmacy. And again, guys, I want to say one last disclaimer. If you are getting good service from your pharmacy, if you're not paying money, if you're going to a Muslim-owned pharmacy, please, 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 don't give me your business. I'm not in the market of taking business from other Muslims. If you're going to a CVS, if you're being treated poorly, if you are some deficiency in your care, then please speak to any of these young men and we'll help you as best we can. We do vaccinations. Alhamdulillah, we have a young Muslima who's also a pharmacist. So for you guys who want to bring your wives, I don't believe that a male pharmacist should be giving your wife a vaccine. We have a Muslima. And for you men, a woman shouldn't be giving you vaccines. We have a bunch of males. I'll give you the shot myself. Okay? Assalamu alaikum. Guys, thank you so much for taking the time to listen to me.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you, Brother Kareem, for this excellent talk. I know many of you might have more questions. Just give me 5 minutes. Many of you might have questions on your medications that you want to ask the pharmacist alone. We will be having a health clinic in a couple of weeks. Look out for the flyer. They will be doing your blood pressure assessment, your diabetes check, your cholesterol check, your medication check. All of you can bring your questions to Brother Kareem, inshallah, at the health clinic, or grab him tonight if you can. 2 quick reminders. Sunday school starts September 10th. Please register your children. This Sunday we'll be registering 11 to 1 here at MC&J. Maktab starts September 6th. We are passing out free backpacks to children in need, full of school supplies. Brother Kareem and Crossroad Chemists have graciously donated backpacks full of school supplies. If you have children that need a backpack, let us know, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Man, once it's food time, they just get up. They don't wait, man. There's like no waiting. It's like, boom. The line is in the back. Assalamu alaikum. That was awesome. That was good. You see the question?
Yeah.
They wouldn't stop, which is good, which means the clinic will be nice.
Yeah.
I think they'll have a lot of questions one-on-one. Some people don't want to ask them personal questions, right? Private questions.